to that in the presentation. Our operating fund, which is our day-to-day operations, that's going to be our biggest cost annually, and then our capital facilities, which our vehicles, our equipment, unfortunately, are not cheap. There's a lot of money tied up in bulk stock in fire and rescue and EMS services. So I'll try to highlight the slides. So the stabilization fund is for post-employment benefits, and in the labor contract with the firefighters union, and this also applies to some of the represented sworn staff, non-represented sworn staff, is a benefit that has a health insurance benefit at retirement. And so protective service employees at North Shore Fire are, just like at Shorewood Police, are in the Wisconsin retirement system. And generally, the average retirement, or the age that you're eligible to retire in that system is between 50 and 54 years old.
For protective service.
For protective service. Most of our employees will work till 53 or 54 on the protective service side. We rarely see someone leave earlier than that. And so you have a gap that at one point in time, benefits for health insurance in that time period between retirement and Medicare were negotiated as part of the labor contract and continue to exist. The cost for those, as I said earlier, health insurance if you look at the 20-year period, for quite a number of years, we were looking at cost increases in the 20% annual range. For us, it has fortunately slowed down a little bit, but we went several years with excessive double-digit increases on our premium costs. Those costs rose quicker than the revenue, and also another issue that occurred was, so when the department consolidated in 1995, the predecessor municipalities all carried some level of retirement costs. That was unusual even in the predecessor municipalities to have a benefit like that. The municipality, so if I was a firefighter in Shorewood and I retired in, let's say, 1993, so prior to the consolidation, the village of Shorewood carried that benefit cost for insurance even after the consolidation of the fire department happened. So that stayed in your budget. When the North Shore Fire Department was created on January 1, 1995, the retirement benefit line item was zero. So as our employees have aged, and as our workforce has turned over, our costs relating to that have risen, not only because of the cost of insurance and the benefit, but because of the number of people receiving the benefit. So in essence, we started at no one receiving the benefit and have had to creep up to where we're going to be probably this year or next year at almost a full cycle of employees. So we'll see, I shouldn't say a full cycle, but we'll see the average number of employees looking out for the future that will be covered by the benefit. So people are starting now to fall off of the benefit as they get Medicare, and then as they come on, whereas we were just continually raising.
So we're getting into a steady state situation.
Right. So this fund was created to make a steady state to pay for that benefit. For several years, as those insurance costs went up, we were exchanging bodies, i.e. people, firefighters, vacant positions, moving the salary to that benefit line, and it was creating a challenge to continue to operate. So this was created and is projected to fund out through 2030. And the only reason we picked 2030, I'm not saying that we're going to fall off the edge at 2030. It's just that was the point in time that the study looked at that said this would be funded. We would be able to fund the benefit through 2030 without affecting other operational aspects of the department if about $597,000 annually was put into that line item. So that's the cost for the benefit. So out of that section, really the committee that put this report together felt that this was a stable area of the organization to monitor it. There are always changes in benefits that are available to employees as time goes on. The state, there was a major change in the ability of the employer to manage health insurance in 2011 through the state. Prior to 2011, the employer and the employee group, which about 95% of our employees are represented by, could negotiate the plan design of health insurance, and that changed with Act 10 and 32. And so we have made some significant changes to our plan design. I don't know that the employees would call them as favorable, but they have been, they've allowed us to manage our budget in this area.
I guess what's important there is, you think that Act 10 didn't affect protected services, but it does affect it in where you said.
Right. And so we have, we're always looking at what is competitive, and that's more and probably in line of some other employee groups now, is we need to remain competitive with our benefits. We have probably, with our changes in plan design, are finding ourselves on the higher end of the deductible range for public employees right now. And so we're trying to manage that and remain competitive, but also be mindful that we don't have a lot of room to move higher right now. We made a significant change from a deductible level of about $500 for a single plan and $1,000 for a family plan to $2,000 for a single and $4,000 for a family plan, which from a public sector side is probably I don't know if you're going to find anyone with a higher deductible at this point. But so our room to move is limited as far as recruitment, and then also with some of the Affordable Care Act issues that are out there too. So our operating fund, that is what pays for the day-to-day service. Our operating fund, let's see here, this one slide, there we go. Our operating fund is at about $14.7 million. With, as I said earlier, 5 stations, 105 employees. The municipal contributions, so what is paid for by the 7 municipalities, account for 80% of our revenue. 20% of our revenue is from fees for service and other small grants and things like that. Majority of that $2 million, that is the 20% of the non-municipal revenue, is made up of fees for service, primarily for ambulance and medical service provided. So we bill for that service, and there's a fee structure for that service. 85% of our expenses are related to salary and benefits. So those are the bottom 2 key numbers as we move through this part of the presentation. Is 80% of our revenue is municipal, 85% are related to salary and benefits, 85% of our costs.
How's your fee collection rate?
So we had our payer mix is 60%. Our payer mix. So primarily, if when we look at ambulance service, when we're billing, we're either billing private insurance, Medicare, Medicaid, or Badger Care, or out of pocket. Basically, someone that's going to pay for the bill all by themselves. Our population that we service, about 60% of our service is Medicare, Badger Care, and Medicaid. So our payer mix, because those fees, we could send a bill for $1,000, let's just say, to a Medicare or Medicaid patient, and they're going to pay about $343 for that service. We can go and try to get 20% of that, but after that we can't. It's against the law to go after and collect the remaining difference on that. So about 60% of our patients fall in that category. So when you look at what we're collecting of what we can collect, we're 80, 85. I mean, we do well. We have a good collection agency, or a billing agency. We don't send a lot to collections. But the write-offs, when you really look at our numbers, it looks like we're writing off a lot because we're forced to write off a lot of that money. We can't collect on that money. So there's the binding agreement that creates the North Shore Fire Department between the 7 municipalities. That agreement, when you're looking at money, which is the driving factor of a lot of discussion, the agreement says that the increase on the municipal contribution, so on 80% of our revenue, is limited to CPI plus 0.5% on an annual basis. That, I think, and the committee found, is somewhat of a challenge, especially in recent years when the CPI has been 0, but operating costs continue to rise at the range of about 2%. So if you're not getting any new money, but your costs are going up 2%, I think we're all here can figure out quickly where that goes. The average CPI for the 7-year period that the committee looked at was 1.64%. The average municipal contribution for that period was 1.45%. So you had a gap even though the agreement says between the 7 municipalities, CPI plus a half. Clearly, that's not used as, the CPI plus a half is not the norm. That's the top end of what can be allowed. Because if it was the norm, or if that's what was basically, we just all agree to do CPI plus a half, that increase, that 1.45 probably should look more like 2 or 1.9%. So there's a gap there even at what's allowed, which from a fiscal perspective shows I think there's a lot of decision making that goes into the budget. It's not just, hey, we need CPI plus a half, what is it, give it to us and we'll walk away. The average wage increase over that time, so let's call that about 80%, 85% of our expenses was 2%. So our revenue from the municipalities, which is clearly our largest chunk, was going up 1.4%, 1.45. Our costs on 80% of our budget were going up 2%. So again, we run into, just like most municipalities, I think these days, a structural challenge of how to continue to provide service with that structure. So over the time since 2004, we have had to reduce positions all through attrition and find ways to do things more efficiently, rely on more technology. And at times that becomes challenging. Just like law enforcement, there aren't robots out there doing public safety jobs yet. You can computerize some things, you can automate some processes, but the actual people that are going out still need people on the vehicles. So that has become a challenge, and at the same time, so we reduced our daily staff by 6 positions. Our call volume in that same time has gone up 150%. So our reliance, or the community's calls for service has significantly risen over the time. And a lot of that is, again, driven at the medical side, so calls for service. That continues to increase annually. As I mentioned before, one of the ways we offset some of those costs was through a 14% reduction in premiums for the employee health insurance plan design. And the committee looked at a number that said, hey, what if we had made these changes? What if we just kept doing what we were doing in 2004 and just said, hey, we need to keep paying this bill? It's about $2.2 million in cost reductions. That would be, or savings, cost reductions are the one that occur. So as I indicated, one of the reasons for this discussion that started a year ago was in our budget presentation from staff, the question came up about, hey, if we keep, and we were basically reducing 3 positions on average every year. So if we keep doing that, at some point, as the chief, I came forward and said, hey, I need to get some better direction as to, we have 5 buildings, I can't have empty buildings. At some point, we have to make a decision. What's the long term here? And can we keep going? It's not a question you probably haven't asked yourself about other services you provide in your municipality here in Shorewood. But it was a discussion that I asked the board to have, and hence how the committee was put together. The modeling that we came out of, and after some significant discussion by the committee, which really revolved around how many physical locations do you want to have, what's the level of service that wants to be provided, was keep the 5 physical locations. The service, what does it take to continue? So we modeled what's the cost to continue, and that showed a 2.5% annual cost increase every year, which for municipalities can present a challenge. So I talked about some of that savings and how we have managed to continue to provide and then actually decrease our average response times over the time when we've had these changes in personnel. Our call volume has gone up. And one thing that as we continue to have, as the committee discussed, what's the sustainable model moving forward? One thing that I think is important to point out, and at times has come up in discussion at different levels, is we have relied on our neighbors more to assist us than we had in the past. So in other words, our neighbor and our whole western borders of the city of Milwaukee, from Shorewood all the way to Brown Deer, for many years there was sort of at least in our service, sort of the wall existed. Milwaukee did their thing and the suburbs did their thing as far as fire and EMS. And about 6 years ago, they had a change of administration in the city of Milwaukee, who came from outside, from another part of the country, and said, why is this, we can work together. And we have probably established a working relationship now that we're asked to come and talk about that relationship at other areas of the country because of the change that's happened. We've relied on them more, they rely on us, but at some point, if it can't be the word mutual, so in other words, I'm helping you, you're helping me, at some point you're going to say, if you can't help me, I'm not going to help you anymore. So our discussion moving forward with the committee has been, hey, if we get to that point where we don't have enough resources that once in a while